This video will give you an idea of what to expect when you come to Memorial Sloan Kettering's main hospital on the day of your surgery. When you arrive at the hospital, use our main entrance at 1275 York Avenue. It's on the west side of York Avenue between 67th and 68th Streets. Once you come in, head up the escalator and make a left toward the elevators. The day before your surgery, you'll have received a phone call telling you when to arrive and which floor you should go to. If you're having surgery on the second floor, use the M elevators to get there. If you're having surgery on the sixth floor, go a little further to the B elevators and go up to the sixth floor. If you need any help, just ask our security guards at the entrance. They'll be happy to help you get where you need to go. Now, whether you're having surgery on the second or sixth floor, your first stop will be at our concierge desk. When you check in, we'll ask you some basic questions and give you a wristband with your name, date of birth, and medical record number, as well as other hospital information. A member of our staff will take you and one person you have with you to the pre-surgical center. You'll be given a garment bag for your clothing and a gown, robe, and socks that you'll wear into surgery. It's best to leave your valuables at home, but if you have any with you, we suggest you leave them with your friend or family member. Your pre-surgical center nurse will review your medical history with you and make sure that you're ready for your surgery. Once you've completed the check-in process, other family members and friends you have with you can join you while you wait in the pre-surgical center area. Surgery times are not exact. We do our best to stay on schedule, but we may need to adjust the schedule to be sure our patients receive the care they need. While you're in the pre-surgical center, you'll see some of the members of your healthcare team, including your operating room nurse, anesthesia care provider, and member of your surgical team, such as a fellow, resident, or a physician assistant. When it's time for you to go into the operating room, a member of your surgical team will take you in. If it's safe for you to walk, you can choose whether you'd like to walk into the operating room or ride on a stretcher. While you're in surgery, our staff will direct those with you to wait back on the first floor, at the top of the escalators near the gift shop. A nurse liaison will round through the operating rooms and get updates on those having surgery. The nurse liaison will share this information with the friends and family you have with you. It's okay for them to leave the first floor, like to stretch their legs or get something to eat. The nurse liaison will call the person you identified as your care partner when you checked in. When your surgery is finished, your friends and family will be called back up to either the second or sixth floor where you had surgery. Depending on the type of surgery you had, your surgeon may meet with your friends and family in a private consultation room to discuss how the surgery went and answer any questions. When you get into the operating room, you'll probably notice it's chilly, but your bed will be warm. You may also notice lots of equipment and people in the room. We know this can be overwhelming. Just know that we're all here for you, and we'll make sure that your surgery goes smoothly and safely. Once you're on the warmed table, we'll put a safety belt on you and connect you to monitors. This will allow us to monitor your heart rate, blood pressure, and oxygen levels throughout your surgery. When it's time for you to go to sleep, your anesthesia provider will have you breathe oxygen from a mask. You'll then be given medications through your IV, and you'll drift off to sleep. During your surgery, your surgeon may send a sample of your tissue to our pathology department for review. If so, your surgeon's office will contact you when your results are available. When your surgery is finished, you'll wake up in the operating room. Most people don't remember this because of the anesthesia. You'll then be taken to the recovery room. In the recovery room, you'll be attached to monitors, so we can monitor your heart and your breathing. Depending on your surgery, you may have drains or other medical equipment. Your nurse will work with you and your surgeon to be sure you're getting the medication you need for pain. While you're in the recovery room, a staff member will escort up to 2 of your friends and family to your bedside. If you're staying in the hospital, you'll be taken to your room when it's ready and you're well enough to go. If you're going home, your nurse will review your discharge instructions with you and your care partner, and you'll be discharged from the recovery room. If you have any questions about how to prepare for your surgery at Memorial Sloan Kettering, call your surgeon's office.